Welcome back to Midday Kentucky, everyone, where you've heard stories about Dr. Eric Smith and the life-changing surgeries he performs at Georgetown Bariatrics and Advanced Surgical Services. Dr. Eric, of course, is on the forefront of providing metabolic surgery. In fact, he's performed well over 1,000 of these procedures, but today we wanted to do things a little bit different, so we decided to do a whole panel of his patients that maybe have had surgery or are about to have surgery. So let me introduce you to, of course, Dr. Eric Smith. Welcome back to the show, my friend.
Thanks for having me.
It's been a while.
I know. It's been a
How
couple
are
months.
you?
I'm doing good.
You look good. Fit,
you.
healthy, tanned.
I'm trying. I put on a good front.
Okay, I'll do you. Okay, now let me introduce you to Erin. Now, you haven't had the surgery yet.
I have not.
Have you? All right, and Kevin Ritchie, who's 6 months post-surgery.
That's correct.
Correct? And also Destiny Jones, who's 10 months
Yes.
post-surgery. How are we all?
We're great.
Good.
Welcome to the show. We
Thank you.
appreciate this. Now, we, of course, have Dr. Eric Smith on all the time, and we talk about these procedures. And I just wanted everyone at home to understand the process and also your personal experience when it comes to having it or considering it. Yeah?
Yep.
All right, so let's start off to begin with, Dr. Eric. Explain metabolic surgeries for people who don't understand what it is to begin with.
Well, you know, bariatric surgery has been used as a term for a long time, and over the past few years, we talk about bariatric and metabolic surgery because it changes some of the metabolic diseases patients battle that go along with obesity, specifically diabetes. There's multiple surgeries that we offer: sleeve gastrectomy, gastric bypass, adjustable gastric band. As a program, sleeve gastrectomy is the most common surgery that we do. It's the most common surgery done in the United States for problems of obesity and other metabolic issues.
Okay, so do you mind if we focus on you three right now? How's that?
Yep.
Okay, so let's talk off with you to begin with. You're about to have the surgery. How did you find out about Dr. Eric Smith to begin with?
I did a lot of research.
Yeah.
I live in Lexington and had seen several doctors and asked lots of questions.
Really?
Yes. And then actually was personal friends with one of the staff members that works with Dr. Smith. And she is the dietitian and really educated me on how it was going to work. I think we all joke, she kept saying, this is a tool. This is not going to be the only thing that's going to change your life. We're giving you a new tool for making those changes, and that made a lot of sense to me.
And that's something that Dr. Eric tells us all the time when you're on the show. The tools that you give them, not only before the surgery, but afterwards. Why is that key?
Well, it's how you sustain results. I mean, obviously, surgery is a permanent change, and that's why it's something that will always be in place to help patients get the results that they want. You know, you do a crash diet, you lose some weight. Well, unless you're doing that diet for the rest of your life, the weight's not going to stay there.
Yeah.
But it is a tool, and so we educate people, okay, we've made this change surgically, but your changes in your dietary habits and your exercise habits have to be in place as well. And so I tell patients all the time, just because my name's on the placard or just because my name's on the website or by the door, there's multiple people involved for your success long term as dietitians and our bariatric nurses, my PA, to help you continue those changes in your life combined with the tool that we give you to get the results.
And that's the important thing, because there's a really great seminar that you all go to. So we've got about a minute left before we go to break. How did you find that seminar for you?
I found it very helpful, even though that I work in the operating room along with him. It kind of gave me a more perspective on what to expect during the surgery and after the surgery as well.
And you, my friend?
It was just very informational, you know, a lot of details and stuff, a lot of things that you just wouldn't know without actually attending a seminar and getting to the nit and grit of the procedure.
And the best thing about it is you get to ask Dr. Eric one-on-one questions.
Yes.
And I think that's key, because you can read all about it, like you were saying. You can go to all the doctors for information. But when you sit there and ask those questions that are related to you as well. Welcome back to Midday Kentucky, everyone. Well, today we wanted to bring some of Dr. Eric Smith's patients in and talk to them about their experiences with, of course, Dr. Eric Smith and Georgetown Bariatrics and Advanced Surgical Services. Erin, we have here, who's not had surgery yet. Kevin has 6 months out. And of course, we have Destiny as well, who is 10 months out.
Yes.
So let's talk about the procedures that we are about to have and what we have had done.
So all 3 patients are either going to have or have had sleeve gastrectomy.
Okay.
Like we mentioned earlier, that's the most common surgery that we do. It's the most common surgery done in the United States for weight loss or metabolic diseases.
Now, because you do 3 different types of surgeries, why have you chosen to do this particular type for these 3 patients?
Well, every patient's different. You know, as a comprehensive bariatric program, you need to offer options. You know,
Okay.
offering one surgery isn't the right way to go about it. However, right now with the data that we know, and for lots of medical issues that patients battle, sleeve is by far, in my opinion, the best choice from a safety profile, from outcomes, estimated weight loss,
Yeah.
and things like that. So these patients have chosen like most patients do.
So what are we looking up on the screen
That's
now?
just a little animation of what a sleeve looks like. You know, many times people hear sleeve gastrectomy and they think that we're putting something in them.
Yeah.
There's no foreign body. We're basically taking the stomach and turning it into kind of the shape of a banana. I always explain to patients, your stomach right now is like a water balloon.
Gotcha.
You put a water balloon on a faucet, it'll blow up 10, 15 times its size. And now your sleeve is like a water hose. It's not going to expand, it's not going to distend.
All right.
And it's going to cause a lot more restriction with smaller amounts of food.
All right, well, I want to bring up some before and after shots of Kevin. Kevin, you started off, what was your start weight?
Start weight, initially when I started the process, I weighed 385,
Wow, and now your most recent weigh-in is 240?
240 pounds.
240 pounds, if we can bring up his before and after shots. When you see this now, and especially everyone on the couch,
Yeah.
especially Erin, you're
Yes.
about to do it, you see this success. How does it make you feel?
It makes me feel amazing. I mean,
How much further do you want to go?
I'm hoping to lose probably about 35 to 40 more pounds.
Really? Okay. How is that process after that? Like he's lost 120 pounds already.
Right.
That's 6 months, everyone. I need you to think about that. 6 months down and 120 pounds. And you want to lose another 30 to 40?
Yep.
What's the process for him now?
Well, you know, I always explain to patients, you know, you've done awesome, you've done great, look at these results, but you have to keep in perspective, your pace is going to change. You know, my example, I say 50% of 100 is 50, but 50% of 50 is 25, 50% of 25 is 12 and a half. So as that excess weight shrinks,
Oh, see, I didn't think
the
of that.
pounds are going to shrink too, so you don't get discouraged. So over the next 3 months, he may lose the similar type of percentage as he did the previous 3 months, but the number's going to be completely different. And a lot of times our job is to make them aware of that. You know, if you continue to do the right things and you continue to eat the right way and you continue to exercise, like we said earlier, your tool
Yeah.
will take over. But you have to set realistic expectations. So we'll sit down with patients when they get 6 months out, because they've usually hit a plateau.
Yeah.
And they might get frustrated and say, okay, well, just wait a second. Let's look where you match up against the national average at 6 months, at 12 months. And then their eyes kind of open up and they're like, wow, I'm actually ahead. You know,
Yeah.
it makes them feel better about themselves that it's okay, that scale doesn't have to change every day.
Isn't he amazing?
Yes.
Yes.
He really
amazing.
is.
He
I
is
love
amazing.
listening to his philosophy about the whole thing. When you see that, Erin, of what Kevin and we just showed you, that's a huge weight loss.
Yes.
Now, do you have a goal or you don't want to know? Or is that too much of pressure on you beforehand?
The number is not so much for me. I have younger children and I want to be able to get on the trampoline and play basketball and not want to take naps and those kinds of things. It's more for me about feeling good.
And that's what we want everyone to know at home. It's really important, I believe, that a lot of us, when we do our diet and exercises at home and we do this weight loss program, not necessarily surgeries, we put so much pressure on ourselves to hit a goal. And then we crack at the 3 months, me included, maybe 3 weeks for me, not 3 months. So you lose the 15 pounds or the 20 pounds, and then you go to the drive-through and it just, you start, you know, making yourself doubt it, you know, and that's by not putting a number on it. You're on the right track. I think it's perfect. We're going to come back after this short break. Welcome back to Midday Kentucky, everyone. I was going to call it a different show altogether. We're back with our good friends at Georgetown Bariatrics and Advanced Surgical Services. Dr. Eric Smith is here with some of his patients and we're talking all about their experiences. How are we coping? We all good?
Good.
Okay, well, let's talk to begin with, and we want to discuss Destiny. You started off at 311 pounds.
Yes.
Huge, my friend, with weight loss. Let's bring up the before and afters of you are now at 199. When you see these pictures now, hello, it's half the body.
Totally different person.
What do your friends say to you?
They're just amazed. This is a totally different transformation. It's been incredible.
Now, on your website, Dr. Eric, there are before and afters, okay? When you looked at the before and afters, did you think, this is going to be me? I can do this.
Yeah.
Did
yeah,
it give you that
yeah.
motivation?
I did find it
Because I know
motivating.
everyone at home, like when we talk about all types of before and afters here on the show, that's what people love to see.
Yeah.
They like to see the results. That's the key. I think one of the most important things that we need to talk about are health concerns, Dr. Eric, of being obese and overweight. Where are we at? Let's talk about you to begin
Okay.
with. What are your health concerns that you have now before your surgery?
I have sleep apnea.
Okay.
Difficult time breathing in the nighttime. And then the most painful is plantar fasciitis. It's a horrible pain in my feet and ankles.
Okay, explain to everyone at home, Dr. Eric, sleep apnea and how that affects your life.
Well, obstructive sleep apnea is something that people battle with a lot if they battle with obesity. You may hear people using CPAP machines. You see commercials all the time. People have to sleep with that. You know, your partner may think, gosh, they just snore a lot.
Yeah.
It affects how well you rest. You know, many patients find out they have it because they think, I'm falling asleep during the day because they're waking up multiple times at night because they stop breathing.
Yeah.
But what a lot of people don't realize is the stress that it puts on your heart, the stress that it puts on your lungs. That just, it's not that you're just not resting well. It's very, very dangerous if it goes untreated.
Yeah.
85% of obstructive sleep apnea is cured with weight loss surgery.
Really?
So that's huge for patients. Not just the comfort of using a machine or sleeping well, but their life.
Kevin, now you were saying that you were pre-diabetic or you were diabetic?
I was diabetic.
Diabetic
Type 2.
Okay, and now this is before your operation.
Right.
And you were saying the minute you got off, you had the surgery,
Yep.
off
No
the
more
medication?
medicines, No.
How quickly after the surgery did this happen?
I quit taking all my medicines for diabetes as soon as the day that I had my surgery.
Is this this is the goal, to
Yeah.
get you off your medications?
Yeah, and everybody's different. You know, some
Yeah.
people, if they've been on multiple medications for years, it may take them a little bit longer. But some patients come off immediately. I mean,
Yeah.
even though they've not made a huge change in their weight yet,
Yeah.
we're able to make those changes with the diet that they're having that's healthier, as well as the changes that have happened surgically too.
Destiny, what were your issues?
I had high blood pressure and sleep apnea. I also had battled depression, I think was related to my weight gain for many years.
When you hear each other's stories, what does that tell you?
It's motivating.
Yeah?
It's very motivating. That was the first time I felt at ease when we had our seminar and we were all in the same room together. It was the first time that I kind of took a breath and thought, I've got this.
Did your families have any concerns about you having the surgeries? And now they've seen the success, but you know, have any of your family said, we don't want you to do this? Or
No, not at all.
Really?
They've all been very, very supportive. My kids are even kind of part of the journey and they're excited for me too.
Okay. What about you two?
Some of my family was, nervous and kind of withheld, about it, but afterwards they have just, seen how amazing it's been.
I think the most important thing is people sitting at home, they want to know, what is your advice? Do you know what I mean? Like, someone sitting at home, you're 10 months out, 6 months, about to have the surgery. Someone sitting at home watching you going, I'm still not sure. What's your advice?
Don't wait. That's my
Really?
advice. Just take the plunge. I mean, life's about taking the chance and taking the risk. I mean, there's a risk either way. If you keep being obese, there's fatality, in that.
Yeah.
I think something that's really important that I always try to share with patients when we do live seminar is when we kind of wrap things up, I say the worst thing that you can do is go into this feeling defeated. And a lot of people do. They walk into that process thinking, well, this is my last resort. I've failed on diets. I've failed doing all these things. I may have a family member in my ear saying, why are you taking the easy way out, or whatever, however it's interpreted.
Yeah.
And something that I think is important that I always share with the patients is, and it's a statistic that people don't know. If you take someone who's morbidly obese, okay, and you had them do diet and exercise alone. BMI of greater than 35, qualify for surgery. Diet and exercise alone. I don't care if they go on The Biggest Loser. I don't care if they have a personal trainer, anything. Their chances of losing enough weight to get out of that category and keep it off for more than a year is 1%.
Wow.
1%.
Crazy.
So who would choose a treatment that has a 1% success rate versus something that has a 65% success rate?
You're right. We're going to go to a break. We'll be right back. Back soon, everyone. Welcome back to Midday Kentucky, everyone. First of all, I want to thank all our brave patients for coming in. We appreciate you and sharing your journey. And of course, Dr. Eric Smith, who's just the surgeon in America.
Yes.
You always give us such great information. If you want to find out more information on how you can start your journey, a healthier you, everyone, Georgetown Bariatrics and Advanced Surgical Services. Visit their website. They have great information on there, lots of education. There's the phone number as well. The operators are standing by now as well. Go over to their Facebook page. We appreciate everything that you're doing. Good luck.
Thank you.
I wish you all the best. I know you will be a success.
I think so too.
Yeah, you really are. Good luck with your journeys, my friends. I want to see you back in a couple of months. See how they'll all be like this. They'll be super skinny. Then I might be able to have something. Thank you, thank you. Thanks for watching Midday Kentucky, everyone. Have a wonderful weekend. Appreciate you. Bye now.